An 81-year-old male patient was admitted for a scheduled laparoscopic, a minimally invasive surgical or diagnostic procedure that uses an endoscope to view structures of the abdomen, cholecystectomy, which is a surgical removal of the gallbladder, because of cholecystitis, which is painful inflammation of the gallbladder's wall. His weight upon admission was 143 pounds and his height was 65 inches. Anesthesia was introduced, and about 50 minutes into the operation, the patient's systolic blood pressure suddenly decreased from 130 to 70. And the patient's heart rate increased from 90 to 140 beats per minute. Even though phenylphrin was administered immediately, the patient's systolic blood pressure dropped to under 50. The operation was discontinued and CPR was started. Defibrillation was performed using a biphasic defibrillator. Cardiac rhythm reverted to a sinus rhythm, and blood pressure and heart rate recovered to 120 over 80 and 140 beats per minute following the cardioversion, which is a process of using a defibrillator to restore the heart's normal rhythm. Carbon dioxide embolism. An embolism is an obstruction in a blood vessel due to a clot of a foreign matter. Was suspected as the middle hepatic vein had been injured during the surgery. A transesophageal echocardiography, which is a diagnostic test using an ultrasound in the esophagus to create a clear image of the heart muscle, was performed, and the presence of multiple gas bubbles in all cardiac chambers were noted. To prevent possible cerebral embolism, the patient was placed in the Trendelenburg position, which is a supine position with the feet elevated above the head at a 45-degree angle. The operation resumed an hour later. The surgical procedure was completed. Once the patient was extubated, he was able to breathe spontaneously without any difficulty. Since the patient showed disorientation as to his name or place, he was admitted to the intensive care unit. Disorientation was fully recovered within an hour, but the patient did show weakness in his left arm and leg. CT scan, 3D angiography, and an MRI were done and showed chronic cerebral cortical atrophy, which is a decrease in the outer layer of the brain tissue that was developed slowly over time, and chronic microvascular encephalopathy, which is a degenerative brain disease due to poor circulation through the capillary network that has developed slowly over time. Without any acute lesion, the patient's muscular strength improved, and by postoperative day 3, it was completely recovered. The patient was transferred out of the intensive care unit by postoperative day 5 and discharged home on postoperative day 10 without any complications or sequelae, which is the consequences of particular condition or therapeutic intervention. So basically what happened is this old man went into get his gallbladder removed because it was inflamed, and he went into cardiac arrest, and CPR was started, after which defibrillation was performed, and they restored his normal heart rhythm and blood pressure, and the operation was completed an hour after that, and he was admitted to the ICU due to disorientation and weakness in his left arm and leg, and by postoperative day 3 his strength had returned, and by postoperative day 5 he was discharged from the ICU, and by postoperative day 10 he was discharged from the hospital and sent home without any complications.